Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls at 866-870-5752. And right now, Dr. Darrow is speaking with Virginia.
Virginia, Dr. Marc Darrow, how are you? You still with us?
Oh, I think she's not. Let's go to Chuck in Anaheim.
Well, we're gonna hang on, Nita.
Oh,
Chuck,
okay.
You just stick there for a second. I got a
Sure.
couple of things to say quickly.
Okie dokie.
So it was interesting. Virginia was kind of shy on the phone. She told us that. You never have to be shy to call us. Give us a call at 866-870-5752. That's 866-870-5752. We'll send you out a free book that I wrote called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got the foreword by the beautiful Suzanne Summers, who's an advocate of natural medicine, and regenerative medicine is natural medicine. All we do is stimulate the body to heal itself and rejuvenate itself. This book has over 250 studies on regenerative medicine of platelets and stem cells and how it works, and it has studies on how surgery fails. And I'm not into doing surgeries on me. How about you, Nita? You had some neck pain. We fixed it up with
twice
in the old days.
Yes.
And, I don't know why people do surgeries when they don't need to. And need is a very important word. If you're dying, you need stuff. But for musculoskeletal pain, you don't need to have joint replacements. You don't need to have meniscal repairs and rotator cuff tear repairs. You don't need neck surgeries and back surgeries. So need is a very important word. Be careful. So if you want to, you can always call my office and get a free phone consult with my staff. That's a free consult with my staff. And that number to the office is 800-300-9300. Get your free phone consult with my staff. They're very educated about regenerative medicine. Call the office, 800-300-9300. And Chuck, thank you so much, Dr. Marc Darrow. You've been very patient. What's the story on your low back? How long has that bothered you for?
Off and on for several years.
Okay.
But over 4th of July weekend, I stumbled and stepped back and fell, and it's been nagging since then.
Okay.
It's gotten better, but it's when I try to sit too long or drive too much and then try to get out of the truck, it's kind of like I can't straighten up all the way for, 10 or 15 steps, and then I feel better.
All right. It's very common that it would, I'm not going to tell you what it is until I examine you, but that typically is just the iliolumbar ligament sprain in the low back. And for you folks that want to Google that, it's iliolumbar. The ilium is the pelvis, and lumbar is the lower back. So it's where the ligaments connect from the L4, L5 spinous processes down to the pelvis. And it's something that 80% of people get at some point in their life. With someone like you, Chuck, it's chronic, meaning it's more than 3 months. And it's something that, if I'm correct about what it is super easy to fix. I've had people that have had it for 50 years straight who have had one treatment of regenerative medicine, just quick injections, walk in, get injected, walk out, and heal up. I've had it done to me. It's healed me. And I've done mega thousands of patients who have done that over the last 25 years. So from what you're telling me, it's not a big deal. It can hurt like heck, but it's not a big deal. It's not anything to get nervous about. It's certainly not anything to have surgery about. Any other questions about that?
Okay. So should I call your office to make an appointment?
That'd be the best thing, 800-300-9300 to the office.
I already wrote it down.
All right, man. And if you want to call there right now, they'll give you a free consult on what it is and more detailed and how that works. It's so easy. It's sort of like the bread. It's the bread and butter.
I'm a big believer in alternative medicine. So,
well, you know, the funny thing to me is this is not alternative medicine. This is old school. This is before the orthopedic surgeons were the king of the hill. To me, they're the alternative medicine, and this has been this kind of treatment.
With that.
This kind of medicine's been around since the late 1800s. It was very, very popular in Chicago with two doctors named Hemwall and Hackett. And as they aged, no one really picked up on it very much. And then in the 1980s, it really had an upgrading again with a lot of doctors studying it. And now it's all over the place. I mean, if you look up regenerative medicine or look up platelets or stem cells, you're going to see doctors on every block doing this work. The problem is most of them don't know what they're doing. I'm not putting down medicine, but this is something, if you go to a doctor, go to the guy who does the most. I don't care what it is. If you're going to have a surgery, go to the guy who does the most. I do occasionally refer people out for surgeries, and I send them to the doctors who do the most, and when you do the most of anything, you do get the best results typically, right? So be careful if you ever...
Okay.
Yeah, be careful who you choose to do regenerative medicine, platelets, and stem cells. I've been doing this.
Well, no, I'll come to you. I've been listening to you for, I'm going to say, at least 4 or 5 years.
Okay. I appreciate that. Thank you so much. You are a patient man. So we're gonna send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And why don't you just call the office right now? You can get a free consult there, and you'll learn a lot more about what we do, how we do it, and your chances for success. I won't really know much until I examine you, though. I've got to use my hands.
Right.
Did you ever get an X-ray or MRI? Did you ever go to a doctor for this?
Not on my back, because normally it kind of went away in a couple of weeks. So but this time it seems to be, hanging on a little longer. So
yeah. Well, that's because you're getting younger every day.
Yeah, that's what I thought.
It's so funny. People come in that I treated, let's say, 20, 25 years ago, and they'll say, I injured my knee. Please do prolotherapy on it. And prolotherapy is the weakest of all the regenerative treatments. And I say, well, that's kind of old school. And they say, but it worked on me 25 years ago. And I said, how old were you 25 years ago? And how was your body then? It's like I injured my knee. I've told this story a ton of times. My 85-pound husky Dakota, I had him at the dog park, and he was running full speed, and I didn't see him coming, and he hit the lateral outside of my knee. And the knee opened up in the middle part, so I knew I was in bad shape. And I had injured the ACL, the medial meniscus, and the MCL, the medial collateral ligament. And I limped off that dog park, and my patella was loose. The retinaculum, which is the covering on the patella, the bone in the front of the knee, was actually loose. And I didn't blame the poor dog. I mean, I love him. Dakota's still alive, believe it or not. He's almost 14. He's not doing too good. He's barely can walk, but we love him the same. And he's as sweet as ever and funny as ever. Huskies stay funny their entire life. They've got a sense of humor. But anyway, I did prolotherapy on myself about a dozen times. And each time I did it, it would help a little bit. It would tighten up that patella. And I'd go running, and it would loosen up. And then finally, I did PRP on it one time, and it tightened up so I could run again. And then I did some stem cells later on it. And, there's sort of a hierarchy of healing with regenerative medicine on what is used. And obviously the best treatments today are mixing platelets and stem cells together. Tomorrow, maybe there'll be something else. If there is, I'm going to be one of the first guys to learn what it is, because my job is to help people heal. I feel that's what I was born to do, and I was actually ordained as a minister to heal. And that was done when I was a lawyer years and years ago, back in 1973. And I really didn't understand what that ordination was about until mega years later, when I found out about regenerative medicine and how it actually can heal the body. And I did a fellowship after my residency at UCLA in natural medicine, which is a very healing type of medicine. We don't medicate or cut people. So I know there are times when surgery is a necessity, but it's pretty rare in my book. If you're smashed and bones are broken, yeah, you better get a surgery. But I'd say probably, I'm making up a number because I haven't done the studies on it, but probably 80-90% of the surgeries done in orthopedics, in my book, should not be done, because regenerative medicine can heal with just a simple injection. Anyway, Chuck, I think you were moving into something else on your body that was hurting, but you didn't say it. What is that?
Well, I have on my left foot, on the top of it, I have always a constant soreness. I don't want to say pain. Yeah. Unless I push on it, it doesn't bother me. But,
okay.
Well,
I'd have to look with an ultrasound to see what's going on, which is simple. You walk in the office, take your shoe and sock off, and I put the probe on your foot and take a look. You most likely have a little bit of arthritis in those joints in the metatarsals. And that's usually very easy to fix using regenerative medicine. We use a teeny-weeny little needle. It's like the size of an acupuncture needle, because those are tiny joints. And I get patients with that all the time when they heal up. So if it ever becomes more than just a nuisance and you want to fix it, come on in. I think we can help. And
I definitely will.
All righty. Well, God bless you, Chuck. I appreciate your call. Very informative for everybody. And if you don't mind, Chuck, is there anything else you have to say before we move on?
No, Chuck's gone. But we could go to Damon after you give the phone number if you want.
Let's do it. Damon, hang with me. Dr. Marc Darrow, we're going to go to you in a second for everybody else that wants to call in so you can give us more information about how to heal. And try to stump me, Anita. Give us questions we can't answer so we can learn too. I learned so much from my patients. The phone number right here in the studio is 866-870-5752. I'm going to repeat it. Write it down. 866-870-5752. You call in. I'm going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'll mail it out for free. And everybody likes free things. And this is a great book. I mean, I do love it, I have to say. It's so informative. It's a couple hundred pages of showing how injections are done all over the body. And that's something I do. There's probably nowhere in the body that I haven't injected for musculoskeletal pain. Joints, ligaments, tendons, muscle tears, hip pain, shoulder pain, labral pain, you name it. Anyway, Damon, thanks for your patience. Dr. Marc Darrow, you've got a hip issue. How long has it bothered you for?
Hi, doctor. Oh, man, I've had this probably about, probably about 10 years that it's bothered me.
Have you been to a doctor yet about it?
Yes, I have.
And what was the diagnosis?
The issue is a collapsed femoral head.
Okay.
And osteoarthritis. It all started when I broke my femur bone 20 years ago.
Okay.
And the doctor at that time said, you're probably looking at a hip job in 20 years. And I thought,
sure.
All right, or whatever. And, and I've been plunking along. It's a stiffness, and I'm not in a lot of pain, doctor. It's just I very small amount of pain. It's just stiffness, and I can't walk much, very, very great distances. And so it affects my overall health, my ability to exercise.
How old are you, Damon?
I'm 68.
Okay, so you're 68 years young, and People that age are typically super active, so it must be very frustrating for you.
That's the only arthritis I have at that right there in that area. The doctor says you don't have anything else other than that. So.
Well, yeah, it's traumatic. Did he say you have avascular necrosis of the femoral head?
Yes.
Okay. So I treat those all the time, just so you know. And the fact that you're getting around pretty good means that you should do really well. What we do is we grow back some of the cartilage and that's been worn down, and hopefully get you a lot of relief and give longevity to that joint. The common thing you hear orthopedic surgeons say is you're on the track to get a hip replacement, but I don't believe that. And there's no reason you'd have to do that if you can put enough platelets and stem cells in there to give you what you need. And, the big problem is at your age, doing a hip replacement, it's going to wear out. Then what are you going to do?
Yeah, and I don't like all those foreign things, plastic and everything else in my body.
No, and some people are allergic to the things that are put in there, and they have to have it pulled out. Then what are you going to do?
Well, I still have the plate in my leg, and I don't know what that's doing to me. So
Well, it sounds like you're not having a problem from it, or you might know about it.
No, they wanted to take that out, too, when they do the hip job. That's what the plan was. But I was concerned that maybe the necrosis wouldn't, your technique, your method wouldn't do anything because of the necrosis and the breakdown of the.
Well, necrosis just means breakdown, right?
Oh, okay.
So what it means is there's part of that femoral head that may not have a blood supply anymore, but it may. It might mean that it was crushed during your injury. I don't know. I'd have to examine you to see what's going on.
Well, as a matter of fact, it was. There's a little. When I remember the original X-rays, a little piece that's broken off on the head.
A little dent there. Not a big deal. I mean, it sounds to me like you're doing great for what happened to you, and it sounds to me like using platelets or stem cells, or both together, would really help you quite a bit. Are you doing sports?
Sorry.
Do you do sports? Do you walk? Do you hike? Do you do things like that?
I used to walk I was walking up until about a year ago. I was walking for about a mile and a half every day, but then I had more and more with the hip, and it different pains in different areas, different things.
Sure.
And now if I overdo it or lift something too heavy, I'll have pains in the muscular pains and maybe pains down into my calf.
Sure.
But as long as I take it easy, it's fine. And I just ice it. I don't take any pills. Just ice it and take fish oil, things like that. And I'm fine
good.
after
that's
a
good.
few days.
And my hope and prayer for you is that you'll come in and do regenerative medicine and feel better. Grow some tissue there.
That was why I wanted to call you, see if you actually could do something for my condition.
Well, I can't promise you're going to get better, but I can certainly look at it first and tell you what I think. There's never a promise in medicine. I'm sorry.
I know, but that's my only alternative is a hip job, so I don't know.
Well, it's not your only alternative. That's what people think is their only alternative. There's lots of alternatives.
Uh-huh.
I won't know what to tell you unless I examine you, though.
Mm-hmm.
So, if you want to come in.
Do anything? Sorry?
Did they do anything? What?
Could the stem cells help with the stiffness?
Absolutely. Anything's possible, but I haven't examined you to tell you yet.
Right. Okay.
I don't diagnose over the telephone or over the radio.
Okay.
And
Got it.
a lot of times people come in, they say, I need a hip replacement because I went to an orthopedic surgeon, they told me. And the problem is not even the hip joint. There's so many things in that neighborhood that can cause pain. And when you get a MRI or an X-ray and it shows that there's arthritis in that joint, there's a knee-jerk reaction to get a surgery when it's not even the problem. You can have arthritis and not even know it. You can have arthritis and not have any pain at all.
Yeah, well, he said I had osteoarthritis, but the bone is just barely bone on bone, just barely touching one part.
Yeah. Yeah, I don't call that bone on bone. Bone on bone means come in and get a surgery.
Oh, okay.
You're moving it around. The bone on bone is like two bricks. Have you seen bricks? They're rough. There's no cartilage on them. There's nothing smooth on them. You can't have them slide. From what you're telling me, you're still getting around, and that's not bone on bone.
Well, that's why I didn't understand what he's saying. I mean,
I know. It's just it's a statement that's made by surgeons. I don't like to say it like this, but I'm just going to say it like this. It's an inducement to get a surgery. There's no hope.
Yeah.
It's bone on bone. Well, that's not true. I rarely ever see bone on bone. I see it occasionally, but I rarely see it. I hear people come in every day and say, I've got bone on bone, and I examine them, I laugh, I go, you don't have bone on bone.
Uh-huh.
Anyway, God bless you, man. The phone number to the office is 800-300-9300. Give them a call right now. They'll give you a free consult and tell you more than I just did. So the number to the office, 800-300-9300. And Nita, if you don't mind, I'm going to go to Louise, who's been waiting, and then Rick will get to you too. Do you inject PRP in an area that does not need it? What is the effect? Louise, I'm a little bit confused. Why would I inject it in an area that does not need it? I'm unclear. What do you mean by that?
Well, okay, I need to get in a place I can hear you. I read your book, and I was very fascinated with it. And if the platelets, PRP, or stem cells were put in an area, what would happen to that area if it didn't need any fixing? I mean, what's the effect of the body?
First of all, let me explain something. There is something that's been around forever since we've had injectables, which is called autoheme, Autoheme. You can look that up, okay? It's been a natural healing technique for years and years and years and years. And what's done is people, and I'm not saying it's a good thing or bad thing, okay? I'm just saying what it is.
Okay.
It's where people take their blood and they'll inject it into their body. So they might inject it into their butt. And there are people that say that helps them heal all over the place. Okay? Now we know there's doctors that will take your stem cells and inject them IV, intravenously. And they say that'll heal everything in your body. I'm not saying it does or it doesn't, because I don't do IVs.
Yes. Yes.
So the answer to your question is nothing bad happens if PRP is injected where it's not needed. PRP is just platelets, which are just one of the cells in the blood. It's where the red cells are removed. And platelets have all kinds of growth factors and cytokines and things like that are healing. So when I'm injecting, let's say I'm injecting a shoulder where a lot of injections have to be done because it's a very complex joint, there are areas I'm injecting that don't specifically need, if there is such a thing, to have the platelets put there. So it's a really great question you're asking, and the answer is no. It's not going to hurt you if your platelets are placed somewhere where there is no pathology.
Okay.
It's a crazy question, but it's a fun question. Made me think. And I like that.
Okay, all right. Well, your book made me think. I think I probably should have written all my questions down, but I had a million questions, and the book is fascinating.
Well, thank you. I appreciate that. And do me a favor. Please write all your questions down, and you can call back, next week, and I'll answer them all the best I can. Or you can just email me. If you want to email, just go to the website, which is www.jointrehab.com, and every page has a spot to email me there. I love questions, and I love communicating with people. Ever since I was a little boy. There we go, Nita. It's over.
Yeah, it is. Okay.
Go to the website, everybody, www.jointrehab.com, and send me an email. And call the studio, call the office, 800-300-9300. God bless you, Nita, and all you callers. And Rick, sorry we didn't get to you.
Thank you.
We love you all. Thank you so much.
Thank you, Alex and Suzette, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.